And so I would like to get started and introduce to you Dr. Peter Josling. Dr. Josling is a biochemist, and he's worked for over 25 years in the international health, food, and supplement arena. He's written several books. He's authored or contributed to a lot of different scientific articles. He is a leading voice on natural medicines in the UK, and I have had the pleasure of listening to him speak once before, and he is one of the most erudite, intelligent, and entertaining speakers it's ever been my good fortune to have the ability to listen to. So I think that you're in for a real treat this morning, not only educational, but he makes the learning process fun. So without further ado, welcome, Dr. Josling.
Thank you very much for that introduction, Cheryl. How am I ever going to live up to that reputation I've created? I'm not sure I can do it. Oh, my goodness.
Oh, I have full confidence.
Well, thank you so much, and a very good morning to everybody that's taken the trouble to come along and listen to my quaint English accent, which I do hope you can understand. It won't be very European over the next few weeks because we're probably going to vote to come out of Europe, so this English accent will become even more rarefied. So please listen intently. I'll try and make it as fun as possible, and I'm going to introduce you to something that is very close to my heart. It's a very safe, natural compound that is used for treating one of the most pernicious diseases actually on the planet, which is seasonal affective rhinitis. So this really is nothing to sneeze at because it's a very simple way of getting a very effective relief from allergies. And allergies, as I'm sure the listeners will know, are unfortunately very, very common. So let's look at the different types of conditions that are caused by an allergic response. So if we start on the left-hand side of the screen, there's seasonal allergies, which are basically hay fever during this time frame now when the grass pollen is high, the tree pollen is high, the flower pollen is flying around the air. We're all sneezing. We can get things like hives. We can get an allergy to spores. We can get allergy to molds, and we can get an allergy to food products. We can get an allergy to latex. There are lots and lots of things that the human body doesn't really like sometimes. And what happens is we basically start what's known as an allergic reaction. So what happens is the allergens come into our ear, nose, and throat, and that whole system is linked together. And what they do is they penetrate through the mucosal layer in the ear, nose, and the throat, and they basically get down into the mast cells, which then start a reaction from the lungs. And the lungs will then release a substance called histamine. And this histamine basically causes the allergic response, and you start sneezing, you start coughing, your eyes start watering, and what's happening is your body is trying to prevent all of these pollens and allergies from reaching your lungs. And the response is an immune response from your immune system saying, I really don't like what's going on, and if I can do something about it, I will cause these symptoms to try and relieve the pressure that we're under. So if we look at the United States, on the next slide, you can see that, unfortunately, right the way across the continental United States, there are different types of seasonal allergies that can cause people problems. If you look in the top left-hand corner, the grass pollen season literally is from March till August, but it varies depending on where you live in the United States. So in the, as you can see there, between May and August, it's the top half, the northwest and the northeast. And this varies according to the season and according to the allergen. So look at ragweed, for example. That's most common across nearly all of the United States between August and October. And then if you come on to weed pollen, you can see again that's very common between July to October. So unfortunately, it doesn't matter if you're a road warrior who travels all around the United States, like I know some people are, or you just happen to live in the state of Florida, you are going to be suffering from allergies if you're sensitive all year round, unfortunately. And that generally means mostly between April and October. But in some of the work that's been produced and published on the compound we're going to talk about today, I found, certainly in my research, that many people were allergic all through the whole year. And that means that these people become their own experts at their disease and what they can use to treat it and make it better. So it is quite a serious problem. They reckon there's about 50 million people in the United States who would basically be exhibiting an allergy. Now, I think it's actually quite a lot higher than that because a lot of people don't necessarily associate going out into the fresh air, sneezing, getting a runny nose. They don't necessarily associate that with having a defined allergy to something that is in the air. So I would suggest that the numbers are probably 2.5 times that amount if you were to be able to diagnose everybody who is allergic either to something in the air or people who are allergic to their pets. So the next two columns there, you can see that there's around about 18 million people who have diagnosed hay fever, and around 10 million adults and children who actually have an allergy to their own pets. So this, as I know to my cost, is a terrible thing to have. I'm not an allergic person, but a good friend of mine would come round regularly to my house and unfortunately start sneezing as soon as she walked through the door. And that's because I have 3 cats. And she is terribly allergic to cat hair. And any of you who know and have cats will know that it's very difficult to get rid of all of that hair sometimes, particularly during the molting season when they're losing hair all over the house. So it can be quite a difficult problem. The other thing that's very common in houses around the United States and in Europe is an allergy to dust. And dust is when you get that lovely Hoover out to clean the house and all of a sudden you sneeze uncontrollably. Now, my wife has already said to me, Peter, you need to start doing the hoovering because I can't do it. I sneeze as soon as I put the Hoover on. So already I've taken on another job in the house because I don't have an allergy to dust. But it is a very, very common occurrence. And that means that many, many people find this particular season, spring and summer, very, very difficult to deal with. And in fact, it is the cause of something like 13 million annual visits to physician offices in the United States. I think it's actually probably quite a bit more than that, as I said, because I do believe that allergies are seriously underdiagnosed. So it is a major problem. And what have the pharmaceutical industry come up with to treat this problem? Well, you only have to go into the local drugstore and see a whole plethora of pharmaceutical agents that run from antihistamines, young ones, old ones, decongestants, anticholinergics, combinations of all of these compounds, inhaled steroids, inhaled nasal sprays, inhaled saline. There are hundreds, literally hundreds, of different compounds that can be used to try and treat allergic rhinitis or hay fever or allergy. Now, with any pharmaceutical drug, you almost certainly will know that it targets specifically at one particular area. It goes straight to the root and hits the root hard. So if we look at the very first group of drugs that were invented, they were the anticholinergics. And what these drugs do is they block the action of acetylcholine. When this is basically a chemical messenger that tells your body to react and to start the immune response to an external allergen. So what it does is it decreases your mucus production and starts to relieve the symptoms. But unfortunately, you also need acetylcholine as one of your normal body messengers. So particularly in your neurological system, it's very important that you shouldn't block the production of acetylcholine in particular in your own body. But of course the drugs do that. And I can go on for hours about the side effects of pharmaceutical agents, but just to give you one recently published clinical trial, if you go to PubMed, it's very simple to type in any subject and you'll find the most recent data that's been published. So here we look at a journal called JAMA, Journal of the American Medical Association, which is a top-rate journal, published last year. Look at the title, The Cumulative Use of Strong Anticholinergics and the Incidence of Dementia, a Prospective Cohort Study. So because these drugs have been around for such a long time, and people with hay fever and allergy have taken them for so many years, it becomes quite easy to follow those patients and see what the cause and effect of an anticholinergic medication is in their real life. So here you can see that the conclusion was that patients who use anticholinergic drugs on a regular basis have an associated increased risk of dementia. And efforts to increase awareness among healthcare professionals and older adults about this potential medication-related risk are important to minimize anticholinergic use over time. So it's the same old story, isn't it? That's why someone like me is in the natural health industry. It's why we search for natural treatments that can be effective and safe. We know that pharmaceutical agents in some people are necessary. I take myself in case. I'm a diabetic, so I don't make any insulin, therefore I have to inject insulin into my body. That will cause some side effects. Those have to be managed over many, many, many years. However, I don't think they cause dementia, unless you think I am going crazy during this presentation, and hopefully that's not the case. But the serious point I'm trying to make here is that the drugs that are routinely dished out by doctors to treat allergy, that's the anticholinergics, the antihistamines, the inhaled steroids, all of these drugs have some serious, potentially serious side effects, especially with long-term use. And when we get on to looking at some of the data, you'll see that a safe, natural alternative is now available that does not cause side effects. In fact, we have a joke in the office. We always say that the only side effect that's caused by this inhaled powder, which we'll talk about in a moment, is that you get better. And that is an interesting side effect to talk about. So let's move on a little. So I'm going to introduce to you what's known as the world's first powdered nasal spray. And it is what's known as hydroxypropylmethylcellulose powder. Now that's a ridiculously long name for basically a powder that comes from the stems and leaves of trees and flowers and plants. Now how ironic is that that kind of compound can be used as a drug-free alternative to treat allergy. Yes, that's what I'm going to show you over the next few minutes. So HPMC is, to put your mind at rest, it's an incredibly widely used substance in the natural world. In fact, interestingly, of all the pharmaceutical drugs that have been manufactured for blood pressure, for cholesterol, for endocrine disorders, for all kinds of heart problems, for all kinds of medical conditions, 99% of them actually contain HPMC. It's what's known as a binder. So it pulls pharmaceutical compounds together so that they can be made into a tablet to be able to dose to a patient. You also find cellulose in very, very, very many food sources. So you're eating cellulose every single day. It's a particularly natural compound. You have no need to worry about it. It has a vegetable origin, and it's been proven now in a number of controlled trials to be a very interesting and exciting treatment for allergic rhinitis. You do insert it into your nose. It's a powder. You squeeze it into your nose, and as soon as it hits the moisture layer in your nasal cavity, believe it or not, it turns into a gel, like a gel that you would buy, like aloe vera, for example. And we'll show you exactly what it looks like in a minute. But what we've shown through controlled trials is that it's inert. That means it has no pharmacological activity. In other words, it is not a drug. It is a completely natural compound that has no pharmacological effect on your body whatsoever. What you're doing is producing a barrier layer, and that stops the pollens, the toxins, the environmental toxins, the funguses, the viruses, the bacteria from coming into the nose and sitting in the nasal cavity, going through your mucus layer and causing this immune response or causing certain types of disease, which we'll also talk about in a few minutes. So the really cool thing about this stuff is that there are really no side effects to talk about. So let's move on. Here is a microscopic photograph of the microcellulose powder. On the left-hand side, this is the dry powder, and you can see that it's composed of a number of granules that vary in size from about 10 to 400 microns in size. By the way, if you're worried about putting that into your nose, again, it's been proven that these dry powder cellulose compounds does not get back into your lungs. So you don't have to worry about that. Then you can see on the picture on the right-hand side that as soon as you squeeze it into your nose, it actually forms a layer over your normal mucus. And if we continued this picture on for another 15 seconds or so, you would actually see that this white layer becomes colorless and looks exactly like your normal mucus layer. So it's really simple. It's like, you know when you go around airports, you see all the Chinese and the Japanese people, they have those funny masks over their face, even when they're going through, what are relatively safe areas like England and America. But they seem to panic that they can pick up bugs from anywhere. And that's true, you can do that. So what we're doing here is transferring that mask from the outside of your nose to the inside. So it's preventing your body from absorbing and those particles from developing and moving down into your lungs and causing an immune response by simply putting a mucus layer over the top of your existing mucus. Very simple, very straightforward, very safe, and as we'll see in the next few minutes, very, very effective. So, where did I get involved with this company? Well, I'm very pleased to say that my involvement goes back over 12 years. Gosh, I've done the maths wrong there. It's 14 years. How time flies. Where I was introduced to the cellulose powder at a meeting with the distribution company in 2002. And they said, look, we've got lots of testimonial statements from people that have used this. We've sold it online and it seems to work very well. But we don't really have any clinical data. We don't have any controlled trials to prove what these testimonials suggest, that this powder actually works to prevent seasonal allergic rhinitis or allergies. So I was the first person ever to conduct and publish a clinical trial on this particular type of compound. And to me, it's a very proud moment for me to be the first to publish. And my trial has been quoted all around the world over the last 14 years by lots and lots and lots of other scientists who have been reviewing the data on allergy with a view to reviewing how we actually treat allergy and whether we should be introducing this kind of nasal powder much earlier on in the protocol to treat all cases of seasonal allergic rhinitis. So I've been very lucky to be engaged by the company as their technical advisor and their head of clinical research, and I've supervised the protocols of all the other clinical trials which now are in the 20s. So there are many, many, many trials now to prove that this particular powder is very, very effective at treating an allergy. And I've been lucky enough to present at international conferences and national meetings all around the world. And today, yes, I'm lucky enough to be talking to you all the way across the United States. So I've really been involved with this powder for a long, long time. I've done clinical trials also on its potential use in other disease areas, which are not the topic of today's webinar, but maybe in future, who knows, we'll be talking much more about asthma, about eczema, and also about controlling infection when we look at what compounds can be added to this particular cellulose. And we'll discuss that in a few minutes as well, because the cellulose is not only fantastic at treating an allergy and preventing an allergy response, but it's also really good at carrying other compounds, and we'll see that in a few minutes. So my involvement does go back a long way. This powder has been around for a long time. It's been on the market in the United Kingdom since 1994. In the UK, doctors prescribe it now. It's on the prescription list, and it sells very well as a prescribable anti-allergy compound. They can be reimbursed by the government for treatment, and it's now actually available in more than 60 countries. And recently, in the United States, it was given what's known as a medical device registration. Now, this means that it is not a drug. It is classed as a medical device. And that means that because it makes this barrier and has no pharmacological effect, it is regarded as a device to create a barrier to prevent the pollen, the environmental toxins, all of those nasty microbes from getting into your nose, penetrating down into the back of your lungs and causing an immune response. So it's a very, very elegant, simple treatment that can be added to other treatments, of course, but we'll talk about that in a minute. So what sort of people can use this natural compound? This is what I really like about the stuff. You know, it can be used by pretty much everybody. It doesn't matter if you're 5 years old, 15 years old, or 50 years old, or much older than that. Everybody who gets the symptoms of allergic rhinitis can use this particular compound. The other thing that's really, really important is that pregnant and breastfeeding women can also use it perfectly safely right the way through the pregnancy. The children, once they're born, the babies can use it from 18 months onwards as well. And right the way at the other end of the spectrum, elderly people get magnificent results with this kind of natural treatment. The other groups that find this particularly beneficial, students. Now, most of us will know that when children grow, if they start to exhibit allergies, it can really seriously affect their academic performance. Why? Because most exams are taken in April, May, June, when the pollen season is at its height. And that means they're going into these examination halls with their eyes running, with their nose running, they're sneezing, they're feeling dull, they're run down, they're miserable, they're not sleeping enough. Okay, yes, they might be teenagers and they do all of that anyway, but when you have an allergy, it makes the whole situation far, far worse. And there are trials now to show that students who have allergies do perform less well at exam time than students who do not have allergies. And you know, it goes across the whole world. Anyone needing to drive or operate machinery, for example, if they have an allergy and can get uncontrolled sneezing, or they get this runny nose and runny eyes and they cough at the back of the throat, it's very, very difficult to be able to drive a car. And that's interesting because I can't call him a friend, but he's certainly somebody I know because I've met him a few times. Lewis Hamilton. He's a Formula One race car driver, and he's the current world champion, and yet he suffers very badly from allergic rhinitis. So when he goes to a hot country to race, like America or Canada this weekend, or Malaysia, he has terrible troubles and has to take a series of drugs. And I was able to introduce him to this nasally delivered powder some years ago in England, and he's been taking it ever since and has done extremely well on it. So sports people are another group of people who benefit significantly from being able to control their allergies whilst they're engaging in sport. And that means it's really a really wide spectrum of people that can use this particular compound. So let's have a quick look now at the clinical evidence. There are many, many, many different trials. As you can see there are 25 clinical trials conducted in 7 countries around the world. The manufacturing company have also sponsored a 3-year doctorate research program. They actually have another doctorate research program going on at the moment. And the number of patients involved in total in the studies are over 800. So this is up with the pharmaceutical drug numbers, if you like. It means that the data that we have on this particular compound is as good as the data you would find in most pharmaceutical allergy medications, like the antihistamines, like the anticholinergics, like the inhaled steroids, like the inhaled anticholinergic drugs that are delivered through the nose and the mouth. So we have a lot of data. Over you can see an 11-year period, and some of them are double-blind, placebo-controlled. Most of them are peer-reviewed. In other words, they've been submitted to experts in the area who have reviewed the science, the conclusions, the methodology, and they have been approved for publication. They've also been published and presented at international conferences, and because of the kind of compound it is, remember it's inert, these studies have been done on children, teenagers, and adults. So we've got a very broad spectrum of good quality clinical data to cover the whole family. And as I said, most of them are double-blind, placebo-controlled. They would all be done during the grass pollen season, i.e. when the pollen is at its highest level. Obviously, during trials, the pollen count for that day, for every day of the clinical trial, would be monitored. Also, we've done challenge studies with grass pollen and house dust mite allergen. That means that we bring patients into the laboratory who we know are allergic to dust mite or grass pollen, and we actually inject it into their nasal cavity to cause an immune response. Not a very pleasant thing to do for the patients involved. They're volunteers, of course. But what that means is that we can then look at how quickly something like this cellulose powder can reduce the symptoms and get their breathing back to normal so that they overcome their allergy to the dust or to the grass pollen. We've also done studies on mucociliary clearance. So this is, again, a really exciting area. For those of you who don't know, in your nose, in your nasal cavities, you have millions of little hairs called cilia, and they're beating away and in a constant beat all of the time. Their job is to capture pollens and viruses and bacteria and funguses and spores and molds and environmental toxins that come into the nose. They capture them and they sweep them down onto the mucus, and then the mucus is cleared every 15 to 20 minutes. So your mucus, if you're not a hay fever sufferer, every 20 minutes your mucus layer gets renewed. And that's perfectly normal because it's doing it deliberately to get rid of all the rubbish that comes into your nose. It's swept down into your stomach, where your stomach acid obviously kills out anything that's captured in the mucus, and it gets excreted in the normal way. So what we've been able to do is to look at patients with abnormal mucociliary clearance. This could be patients who clear much faster than normal and patients who clear much slower than normal. And we've shown that this cellulose powder works in all of these areas to improve mucociliary clearance. We've also looked at studies in seasonal and persistent rhinitis. So in other words, people who only get an allergy during the pollen season and people who get allergy all year round, as I mentioned at the beginning of this talk. So let's have a look at the key research results. All of the studies that have been published so far show that in a clinical situation, we reduce sneezing, we reduce itchiness and runny nose, and importantly, we reduce sinus congestion. So the cellulose is a fantastic preventative as well as being a treatment, okay? That's the important thing to realize from this talk. And this is what it is. It's very straightforward. It's very simple to use. On the left, you can see the bottle. It's tiny. I'll tell you exactly how to use it in a few slides' time. But here is the evidence to show that it blocks allergen. So here on the left side, you see the allergens coming onto the mucus layer. It could be dust mite allergen. It could be flower pollen or ragweed. It could be anything. But they come onto your mucus layer. And because you're pushing the powder into the nose, this mucus layer has an extra layer put over the top of it. And that means that you block the penetration of these allergens that get down into the lungs. So that means you should expect to see a reduction in the overall allergen load. And that's exactly what you can see in the graph on the right. So this says the amount of dust mite allergens, DER-P1, in nanograms per milliliter. And in the patients who have no barrier applied, you can see it's absolutely enormous. So there's hardly any allergen that's been prevented. But in the cellulose group, it's tiny. Most of the allergen has been captured and removed to a harmless situation and will not cause you an allergy. Very, very efficient graph. And that was published in, well, it was presented at an international conference in Europe in 2008. So, let's have a look at the next one. This is a simple graphic analysis of the scores between those two groups who were allergic to dust mite allergy. So the placebo group, you can see on the left-hand side, the average symptom score for runny nose for a challenge 4.5 hours later. The differences between the two groups: on the left, the active, the cellulose powder; on the right, the placebo in yellow. A big difference between the two groups. P equals 0.05. This means that if you repeated the study 500 times, you would get the same result. And on the other side, you can see the number of patients showing no symptoms from that dust mite challenge after 4.5 hours. On the left-hand side, the ones that took the cellulose, it's a high number. And on the right-hand side, the yellow bar, it's a much lower number. So the people that took placebo, unfortunately, more patients had symptoms, okay? So there we go. And here again, we can look at its ability of fast block to block allergy to grass pollen. Here again, it's a very big difference between the placebo and the active. So the symptom scores in the active group are much, much lower. Now, this study was conducted in Sweden and in England by Dr. Aberg and Dr. Emberlin, and was published in, as you can see there, Archives of Allergy Immunology in 2014. So this is the sum of the nasal symptoms day by day in the respective groups. So these patients were chronic sufferers. They were recruited and asked to score every single day. They didn't know whether they were on an active or a placebo, but you can see that immediately they started treatment, the active group moves away from the placebo dramatically and continues to fall over the 27-day period of the clinical trial. So you get continuous relief when you take this product every single day. So that's the important thing to take on board, that if you're an allergy sufferer, you should be taking this every single day. You don't need to wait until the symptoms arrive, although we've seen that if the symptoms arrive, you can get rid of them quickly. But what this graph is showing you is that it's much better and more efficient to use the cellulose to prevent the attack from allergy and keep using it, and your symptom score will always remain low, and you should be almost symptom-free right the way through the grass pollen season. Okay, so now this it's the same study, but it's basically the results. So this was done in children between the ages of 8 and 18. So young children right the way up to teenagers. It was a 4-week study, and they used just 1 puff of cellulose powder 3 times per day. So it's a treatment they use 3 times a day. It's very easy to use. It's very simple to do. And unfortunately, I can't do a demonstration in front of you, but I'll show you in a minute exactly how to do it. And for those of you that have already sold the product, you should already know exactly how to demonstrate it to patients or to customers. And this trial suggested that it was particularly effective in reducing sneezing and runny nose. And of course, there were, as you can see on the bottom there, no adverse effects, i.e. no side effects to be reported. Now here, this is another study done in Russia, and this shows how the quality of life improves significantly over the clinical trial period. So the one thing that I know as a clinical trial expert is that when you talk to volunteers, particularly with hay fever, they are their own experts. They know their disease much better than I will ever know it. And they literally are their own experts. So they know which drugs work. They know which antihistamine they like best. They know if they like or don't like anticholinergics. They know if they like taking an inhaled steroid or not. And they show in this particular study that over the course of the study period, their runny nose, their sneezing, their itchy nose, their stuffy nose, their itchy eyes, and the tickle in their throat improved over all 4 checkup times, and this, in the quality of life scores, gave them a much, much higher quality of life. And that's really what this is all about. You know, even the drug companies are trying to improve the quality of life, except, unfortunately, they have pharmaceutical agents that can relieve some symptoms, but they cause side effects. Even the newer antihistamines that they claim are non-sedating, they do sedate, and they take up to 24 hours before they become biologically active in your system. Now, that's no use if you've got an allergy this morning when you wake up. Why would you want to wait 24 hours? You're going to have a terrible day. With the fast allergy block, we see that it works within a few minutes. That's the important factor to take on board. So, this was the study in teenagers, as I mentioned. They recruited 53 patients, 25 in the active group, 28 in the placebo group. They reduced their symptoms significantly. They had less sneezing. They didn't have runny noses. Their lower airways were improved, and they improved their blocked nose. So it's a decongestant as well. That means it does have a very major role to play in sinus congestion as well. And I'm sure those of you listening in will know plenty of people that suffer from sinus problems. So please do give it a go. And if you're not sure exactly about it, let me just go over one more time exactly what it is and how it works. So it's a powder, first of all. It's not a liquid. So when you buy it and bring it into the store, it comes in a box. It's a small bottle full of cellulose powder. It's a patented bottle, actually. It's very clever the way it delivers the powder. You squeeze the bottle, and what happens is the powder goes into your nose, and once it contacts your nasal passages, they are moist, and the powder immediately starts to swell and form a gel. And that's quite important because the swelling velocity and where it reaches in the nasal passages are very important in terms of what kind of response you're likely to get. And we've done lots and lots of experiments now as part of that PhD thesis to investigate the rate of swelling, how it swells in physiological saline, which has the same pH as your nose. We've actually done swelling calculations in human beings, and we've seen how long this persists. We've seen what it does to the cells in the nasal passages. We've also shown that none of the powder has the ability to penetrate down into the lungs, so it's perfectly safe to take into the nasal cavity. And within a few minutes, it basically becomes a gel, and that gel will then capture anything that comes in to the nasal cavity, in through the eyes as well, because that all goes down into the nose, and in through the mouth. Now, okay, there's some absorption through the mouth, but because the ear, nose, and the throat are all connected, everything gets absorbed into the nasal mucosa and swept down by those cilia that we mentioned earlier down into the gut. So remember, those 3 areas are all connected. So this is how it works. Within 15 minutes, most of that powder will have become a gel. It does continue to carry on forming a gel for about another 30 minutes or so, but it does form this affective barrier very, very quickly. And it does continue to reinforce the barrier. And then, of course, if you sneeze, then it's important that you should reapply the powder, and you can do that, as we said, at least 3 times a day. You can do it more often than that because it's, as we said, an inert substance. Now, what's really exciting is that in the last, well, couple of years, I actually came up with this concept in 2003 that we could add other agents to the cellulose, and that cellulose would capture these agents in the barrier that's produced, and therefore those agents could be delivered more effectively to where they're needed. So, for example, here, this study shows the effect of combining cellulose with what's known as topical oxymetazoline, which is a drug that's used to treat allergic rhinitis. And this was published, I think, last year in Allergy and Asthma Proceedings. And what it showed was that the oxymetazoline, which is a drug-produced decongestant, was much bigger in combination with the cellulose than it was on its own. In other words, putting the two together by combining the oxymetazoline in with the cellulose, you got a much better decongestant effect on patients who would normally be very difficult to treat. So adding agents in to each other, to the cellulose, obviously has a very interesting application. So the idea here is to use the mucoadhesive properties of the cellulose to prolong the contact time between drugs, and because I'm not a drug boy, okay, I prefer natural treatments. So I'm going to say to you, cross out the word drugs and put in there natural extracts. And I'm wondering how many people on the line can think of a number of natural extracts that could be delivered to the nose to give a clinical benefit to the human body. I'm not going to say any more about that, but just think about it, okay? So the idea in this study, as I say, with the drug, was to apply a non-adhesive drug formula into the nasal cavity and trap it in there by using the HPMC powder. And of course, by doing that into an adhesive gel, the gel stays there, by the way, for 6 to 8 hours. That's why you should dose it 3 times a day. If you, as I said, if you blow your nose, then you should reapply the gel. But normally, once you've done it, it just sits there quite happily. It produces the barrier. Anything that's flying into your nose gets trapped inside. And after 6 to 8 hours, with normal mucociliary clearance, the mucus will eventually be reduced because when you put the cellulose into a normal mucus layer, what happens is you slow those cilia down a little bit. So you have a longer mucociliary clearance. That means you only have to dose the nasal powder 3 times a day. You can do it more often if you're being overloaded by pollens or toxins, okay? So, there we go. That's the new application. So, in conclusion, we've got a simple natural compound that comes from plant cellulose that enhances the decongestant effect of nasal oxymetazoline in patients with allergic rhinitis. And that means that you can carry on using this drug for longer than a week, whereas normally, under normal situations, you would have to stop it after a week. So, for doctors, this is an interesting application of this cellulose powder. For people who are at the front line in the retail environment, you probably just need to use the cellulose on its own and add it into an antihistamine if people want to. There's a study about rescue medications, which I haven't been into, but here are the main points that come out of the other studies. A, it's very effective and safe to use in children. B, it improves the quality of life in a significant number of patients. My own study, which is not in this presentation, I asked people to rate their quality of life and how effective they felt the powder was compared to other treatments. And 88% rated the cellulose powder to be more effective than all of the other pharmaceutical drugs they'd ever used. I recruited chronic hay fever sufferers. So these were people that had used antihistamines, anticholinergics, inhaled steroids, everything you can think of. and 88% said they thought the cellulose powder was much better and controlled their symptoms much better. No adverse reactions. It's very safe to use. The only thing that people sometimes mention is that you can feel it in the back of your throat. But what they also say in the clinical trials is that it definitely prevents and controls the symptoms of allergic rhinitis, both seasonal and chronic. And again, it's around about 88 to 90% of patients that get benefit, which is a very high number. The other 10%, by the way, I would suggest if you combine it with one or other compound, for example, it could be golden seal or garlic, for example, you might get even 100% benefit to patients. So that's always worth bearing in mind, that other natural compounds could be added in to this cellulose powder to achieve better control in patients who don't find it fantastic on its own. So all the trials have been done and reported with very good compliance. Nobody really ever complained about dosing it into their nose. As I said, just a few people felt that they could kind of taste it actually at the back of the throat. I would say up the nose, it feels fine. Some people think it feels a bit peculiar, but that disappears very quickly. And as I said, no dropouts, or very few, and no clinical adverse reactions were reported. So overall, it's a very clean, simple thing to use. And here, for those of you who are interested, is the simple way to use it. So basically, you gently blow your nose first, you breathe out. You place a finger over one nostril to close it. You place the cellulose powder bottle nozzle in the other nostril, and you slowly but firmly push the sides of the bottle. It's really easy to do. And that will deliver one puff of the cellulose powder whilst you inhale gently. Then you simply wait for a couple of seconds to gently inhale the powder and allow it to penetrate the nasal passage. And then you repeat those steps for the other nostril. So you close the other one, you put the cellulose nozzle in, you squeeze, you give it a couple of minutes to allow it to get into the nasal passage, and that is all you have to do. It's really very, very simple. And as I said, if you sneeze, which occasionally that happens, you can reapply. The powder can be used as often as you need to. It's a patented bottle, so the delivery is controlled through a very special little feature in the nozzle. It doesn't matter if you squeeze very hard, but the harder you squeeze, the more powder you will deliver into the nose. So you don't have to do that. You just squeeze, firmly. But anyone can do it, male, female, young child, no problem at all. If you're using it on very young children, then you can do it for them without any problem whatsoever. Okay? So very simple to use the powder. And as I say, we recommend 3 times a day, but actually you can use it as much as you like. So if you have a very high pollen day, then don't be afraid to use it 5, 6, 7, 8, 10 times a day, as often as you need it. And as we say, the evidence is extensive for seasonal, intermittent, perennial, and persistent rhinitis. We've also shown that it helps to alleviate rhinoconjunctivitis, so that's nasal congestion, runny noses, postnasal drip, sneezing, red eyes, itchy nose, and sinus congestion as well. So we have lots of evidence, and we know that asthma sufferers also get benefit from this, but we don't market it yet as an asthma treatment because the clinical trials have not yet been completed in that area. But as with any interesting compound that works, there are a lot more clinical trials to be done. The data doesn't stop there. And I know for a fact, because I'm involved, that there are some very, very exciting trials coming up in the next 2 to 3 years that will completely be groundbreaking, in my opinion. So it's a very simple, beautiful treatment for allergy sufferers all over the country. We have a very simple preventative and treatment for the control of symptoms of allergic rhinitis in children, teenagers, and adults. It's very safe to use because it's quoted as inert. It has no adverse side effects, and it fits very well with international guidelines And there is a movement amongst allergologists around the world to change the protocols that are used in serious cases to treat serious allergy by introducing this cellulose powder a lot earlier on. So from your point of view, it's something that you should find very simple to use, very effective for your customers or your patients or yourself, and virtually, well, no side effects at all. So I think as far as that's concerned, I should stop. I hope it hasn't been too long and too boring with my quaint English accent. And perhaps, Cheryl, would you come in now? We received some questions. I think that might be the best. But
Dr. Josling, that was incredibly informative. I learn something new every time I hear you speak, and you are so you have such clarity about how you can use something like an inert cellulose powder to have dramatic improvements in health, especially people who have allergies. So we already do have some questions, so let's get right to it. One of the questions is that this person lives with their allergen, and their allergen is cats. They tried the nasal powder, but the allergen still gets in their lungs. So they're breathing it in when they breathe through their mouth, and it's irritating. Is there anything that they can do to improve the powder's effectiveness, or are there additional ways to help reduce their reaction?
Well, I think the first thing I would say is use it much more often. As we've discussed during this webinar, we would recommend 3 times a day. But if you have a serious pet allergy and they're there in the house with you, you may need to use it many, many times during the day because, as you know, pet hair is very fine, particularly cat hair, and that can penetrate into the nasal mucosa layer very quickly. So I would personally, each morning, wake up and use it 2 or 3 times before you have any contact with the animals. And when you are having any contact with the animals, continue to use it before and after you've had contact. So I think the answer there is to use it more often. I mean, obviously, as we all know, pets have seasons where they lose more hair at certain times of the year than others. So if you know the season, the months when it's going to be at its worst, what you should also be doing is building up before that to try and get as much of this powder used to your system as possible. Remember that graph I showed earlier on, showing that over 27 days, the benefit in reducing symptoms increased over that 27 days. So if you can, when the animals are not molting so much, keep using the cellulose powder as often as you can. Remember, because it's inert, it doesn't actually matter how many times you use it. So I think that's the answer to that one.
This may be an old wives' tale, but I've heard that when people have issues with pet dander, especially cat dander, that if you take a damp towel first thing in the morning and then just brush the cat's coat with it, just, not rubbing the coat, but just sort of going with the direction that the cat's hair is already growing, just wiping them down once or twice with a damp towel helps to reduce the spread of dander in the house. Have you ever heard that before?
Do you know, I haven't heard that, but that's very logical. That actually makes a lot of sense. Those old wives always knew what they were doing, you see.
They did, didn't they?
So I think from my point of view, I think that's a jolly good idea. I can't see any reason why that wouldn't certainly help to reduce the load, definitely. Good thinking.
Yeah. All right. Here is a question that several folks have had. After it turns into a gel, what happens? Do you just blow it out your nose, or does it just leave there and eventually it dissolves, or what happens? I know that other people have said, well, does it build up and clog your nose? No, it doesn't do that. So could you explain to us what happens with it after it turns into a gel?
Sure. Well, I did mention this briefly during the presentation, but basically what happens is, as soon as it turns into the gel and develops that barrier, that extra mucus layer over your normal mucus, it just stays there quite happily for something like 6 to 8 hours, which is why we recommend dosing 3 times a day. After 6 to 8 hours, most of that mucus in the noses, in the nasal passages, will have been replaced anyway. So it takes quite a long time to replace all of the mucus in your nasal passages. So what happens is that the cellulose will stay there for quite some time unless you sneeze. And if you sneeze a couple of times quite heavily, you will blow it out. So it's best to blow your nose again and reinstill the powder. So you don't have to worry about it. It'll just stay there I mean, if you look at it under the microscope for a long time, and we've done video cameras up inside the nose, it just looks exactly like your normal mucus. So you can't really tell the difference. It becomes a clear gel. Now, the pictures I showed were before it's been instilled, what the powder particles look like, and then exactly what it looks like once the white powder has hit the nasal passages. I mean, I usually do a joke that I say this is the only white powder that you can legally sniff into your nose. Okay, so don't worry. It doesn't stay as a white powder for very long because it becomes completely colourless and looks exactly like normal mucus. And anybody that's had postnasal drip will know that when the mucus is very thin, it just comes out. It's a clear liquid. So it will stay there for several hours without doing you any harm. What it's doing is it's doing you good because it's allowing your nose, which is the filter for your lungs, to deliver exactly what your lungs want, which is clean air. So as the air comes in, if it's intoxicated with pollens or environmental toxins from car exhaust fumes, for example, or if it's viruses that are flying into your nasal passages, or even bacteria or funguses, they will come in, they'll drop down onto the mucus, they'll be stuck there, and then eventually they'll get cleared down into the gut, as I said, where they are basically totally harmless and excreted. Okay?
Excellent. A follow-up question, do you feel it when it's in your nose?
Again, I personally have never felt it when it's in my nose. The only time I've ever felt it, and in fact, what they've done in some countries is they put a little bit of peppermint in there as well, so that when you take the dose, you can actually smell it. So you don't really notice it in the nose at all. If you take a big dose, in my trial many years ago now, 1 or 2 patients said they thought they could taste it at the back of the throat. Now, interestingly, what we've done is, in the interim, we've done research on actually using the same powder directly into the throat, into the pharynx and the larynx. And when you do that, then yes, you have this feeling that you've got something in your throat, but it only lasts a few minutes, and then it disappears. And that is basically the conversion from powder to gel, which takes literally a few minutes. So it's very unlikely that you're going to feel it actually up your nose.
Well, you know, I have to say in the United States there is some peppermint in the powder, and it's important because it's so gentle and so hard to feel that people are afraid that they didn't deliver a dose because they don't feel anything. So the peppermint allows them to know that, yes, because they sniff a little bit of peppermint, that the proper dose has been delivered to their nostrils.
That's exactly right, Cheryl. If you can smell that peppermint, you definitely delivered the dose, because the patented delivery device is so efficient that as soon as you can smell that peppermint, then you know you've got that dose up into the cavity exactly where you need it to reach, okay?
There's a questioner that says, when you talk about mixing it with peppermint or garlic, do you put that powder directly in the bottle? I think they're asking, it becomes a part of the cellulose matrix, right? I mean, it's blended in the bottle. It's not something you add to it, correct?
No. This is a product development. These are blends. They're very. It's my job as a formulator to be completely technically efficient with the types of powders that are mixed with the cellulose. It's very important to have powders that have obviously a similar density, a similar moisture content. Lots of other features are involved in this kind of combination therapy, and I can foresee that the next 5 to 10 years, Cheryl, there'll be lots of combination products, because we already know with that oxymetazoline study, and in fact some other studies that I've already done, that adding other ingredients into the cellulose can be very, very effective.
It says, this is asking for your opinion. You know, many people who live with pets but are allergic to pet dander go on the long-term series of allergy shots to desensitize them. Do you have an opinion of that therapy? Pros, cons, any ideas?
Well, I mean, you know, this is one of those difficult questions to answer. You need to know what your audience really wants to hear. If you give both sides of the argument, then you can argue that the allergy shots are a good thing. You know, for some people they work very well indeed. I don't think there's really much doubt about that. But they are painful, and of course, with any intervention like that, there is a trade-off against a potential side effect, and there's a trade-off against long-term use. So from my point of view, yes, I can see some people would prefer to go down that route, but me personally, I would prefer to find a natural alternative or a series of natural alternatives to prevent me from going down a pharmaceutical channel. That's not because I'm biased in any way, shape or form. My research shows me that if we can find a natural compound, more people are going to adhere to that than if they have a pharmaceutical alternative. And I've been on both sides of the fence. I didn't declare that at the beginning of this webinar, but I've been in the pharmaceutical industry advising for many years. I'm not there now. I left 25 years ago when I realized that natural medicine was a better answer for more people. So, you know, I'm gonna stay on the fence, if you don't mind, Cheryl, and say for some people, yes, it's probably good for them, but for other people who have, you know, concerns, and some of those concerns are valid, then let's look for a natural alternative. We have one here in the cellulose powder. I've also given a couple of other agents that would help to control an allergic response, like garlic, for example. That's another webinar because there are so many different types of garlic, as we know. And golden seal, there are several other natural compounds that can be added perhaps as an oral dose rather than intranasally with the cellulose to help people get better. Okay.
You know, I have to weigh in, and this is, remember, this is an N of one. But my best friend a few years ago went through a very extensive series of shots to desensitize her to hay fever. Now, it's not pet dander. And her doctor convinced her to do this, and the following hay fever season, her symptoms were reduced by about 80%, and she was absolutely delighted. And then the following season, they were back. So I have to, as I said, that's my experience with someone close to me. I have to believe that while they are useful for some people, for some individuals, for whatever reason, either their immune response is different or the whatever's going on with them is different. But in her instance, she was quite disappointed with their results.
Well, I agree with that. I'll give you another analogy. In the drug industry, there's an antifungal drug that women are supposed to take just one capsule, okay, and that will get rid of a fungal infection and a fungal overgrowth. And that's true. It does work. It's a very good antifungal drug. But what happens is that lasts about 3.5 weeks. And then the fungal overgrowth comes back again. So if you use a natural product, you can get rid of that fungal overgrowth. It takes a little bit longer, but if you keep taking that natural product, which is harmless, you prevent the recurrence of that fungal infection. So from my point of view, that pharmaceutical approach is the wrong one. And it may be exactly the same example that you just quoted, that it might work for a certain period of time, but after your immune system begins to realize what's happened, something happens in those individuals and it fails to work again. And that's, you know, you don't, and with the best will in the world, no one should want to keep taking pharmaceutical drugs consistently, unless you have a well-defined medical reason like diabetes, for me, for example. Without insulin injections, I wouldn't be here. So, you know, but the situations we're talking about, if it doesn't work, don't go there again. Do you agree?
I do, absolutely. A question about insurance, because you had mentioned insurance before. Well, recognize that people can attend this webinar, folks, from anywhere in the world, although the majority of attendees are in the United States. Our presenter is in Great Britain, correct?
Correct, yeah.
And so this person is asking, I don't know what country he's from, will insurance cover the cost of the powder? So it depends on what country you're living in, correct?
It does, of course it does. So I was giving a UK perspective that it can be prescribed by a GP, a general practitioner doctor here in the UK, which means that you take the prescription to the pharmacy or the drugstore, and you then still have to pay about $15 to get the product. So it's not entirely free, even if you get prescribed. And sometimes it can be covered by insurance, and sometimes it cannot. Now, I've just seen on the screen here that the questionnaire is from the United States, so perhaps it might be better for you to answer that question from the U.S. perspective.
Right. It's not covered by insurance in the United States, but it is available over the counter as a medical device. So it is for sale in the United States.
Oh, it's gone dead. Oh.
All right, so although it is not covered by insurance, it is available as an OTC in a lot of health food stores. So there are independent health food stores across the country that will carry the specific formula that Peter has been talking about. All right, and let me just see if we have any other questions. Sometimes we often get asked, have you ever done any studies on this powder with pets?
You mean on dosing animals?
Yeah, there have been some questions on that we've received from people, because just like us, animals can have allergies as well. Sometimes dogs even have like grass allergies or pollen allergies. So, is this something that could potentially be used in pets?
The simple answer to that is that there is a version for horses who get a terrible problem called coughing. And now they have one enormously long nasal passage. But the powder has been used very, very successfully on horses with coughing, and that is a serious problem for an animal. They can be exercised, for example, and come back in a terrible state where they have this kind of peculiarly short, sharp breathing episodes, which is called coughing. And it's very successful. It's promoted in parts of Europe. With regard to other animals, like more domestic animals, it hasn't really been used in controlled trials, but there'd be no reason why it wouldn't work in smaller animals, because obviously the cause of allergies is exactly the same. So I don't see any reason why it couldn't be dosed on a dog or a cat would be difficult, I think, but a dog possibly. Okay?
Yes, excellent. I would like to have a video of any participant who is going to use this allergy product on their cat. I would like to have that. So we'll show it in our next webinar. Several people have asked, I'm sorry I had an audio interruption there for a moment for some reason, but I'm back now. We've also been asked where they can get this product in the United States. We try very hard not to make our educational webinars commercial, so we don't talk about marketing or advertising or product names, but if you are interested, no worries, we'll be glad to send that information to you. All right, folks, I'm just going to scroll through here and make sure I haven't missed any of the questions that have come through. I think we've covered them all. Well, thank you so much, Dr. Josling. We really appreciate you taking time out of your busy day all the way from the UK to talk to us today about how to use natural interventions for allergies. Much, much appreciated. And I hope you'll join us again in the future, especially as you do more research and attempt to use a variety of different ingredients to blend with this delivery system. We would love to hear more about what you learn about that.
Cheryl, thank you so much. I've enjoyed it enormously again, and I hope it was worthwhile. And a big thank you to all of the people that took the trouble to come in and listen to me. Thank you so much.
Thank you. And folks, if you'd like to learn more, feel free to sign up for a weekly newsletter from Terry Talks Nutrition. We are very scrupulous about your email addresses. They will not be sold nor traded to others. And it's about a once-a-week compilation of the latest in natural news, some inspirational thoughts, and information about different natural medicines that may be of use to you. The Terry Talks Nutrition website is a great resource to listen to past recordings of other seminars, and this give us about 24 hours, and this webinar will also be uploaded. And if you would like to refer a friend to listen to this information, or if you'd like to re-listen to it yourself, you're more than welcome. We also have a Terry Talks Nutrition channel on YouTube, so easy peasy, just search on Terry Talks Nutrition. You'll get a whole list of our webinars that you can listen to at your leisure. Our next event is on Thursday, June 30th, with Dr. Carrie Donahue, who's been a very popular presenter with us, an integrative veterinarian who's going to talk about natural cancer prevention and treatment for pets, mostly dogs and cats. So I hope that you will be able to join us going forward for our next educational webinar. Thank you so much for taking time out of your busy day to learn more about natural interventions. I hope you can join us again in the future, and until then, good health to you. Bye-bye.